In this video, we're going to be discussing the heart and the basic information that you need to understand why you need to have an electricity class. Okay, normally, and basic information is that the heart beats between 70 to 80 beats a minute. That's classified as normal, and most everybody knows that. Most everybody also knows that the normal blood pressure is 120 over 80. If my 120 gets too high, I have what they call tachycardia, which would be a heart attack. If the lower number gets too high, then I have a stroke. And the difference between the two is tachycardia is usually fatal, unless you can get an AED machine to them and you can get that heart starting to beat again. And a stroke is insidious because the blood vessels pop, blood leaks out into the brain, and it will paralyze either the left side of the body, the right side of the body. Sometimes it affects your speech center. Depending on how severe it is, it can cause severe problems, and yes, it can be fatal too. So either one is not good, and stress is a huge factor in your health. Some people, when they get really stressed out, get stomach aches like an ulcer. Some have diarrhea, and some, for instance, if I do it, I get asthma because I have asthma. Other people can have the heart issue, so you want to make sure that you try and keep your stress level under control. Remember, don't ever let a client stress you out. Their money isn't worth it. I had a client when I was in the salon, I would see her name in my book. And as soon as I saw her name, my stomach would hurt because I knew that the hour that I was with her, it was just going to be hideous. And finally, after a year, I told her, you need to find somebody else to do your nails because I'm not making you happy and you're making me physically ill, and I can't allow that. And she goes, what? You want me to find a new manicurist? I go, yes, please, and thank you, and walked away. Remember, I call that a hit and run, by the way. When you want to get away from a client because they're aggravating you, just turn the chair to the door, say thank you very much, and go to the bathroom. They cannot follow you to the bathroom. Okay? That's a safe place. So, when we're looking at the heart, we're looking at 4 chambers. The 2 upper chambers are called atriums, and the word oracle is 100 years old, yet one of the students said it came up on her state board exam. She came back and she goes, Miss I. James, what's an oracle? And I go, where did you hear that word? She goes, it was on my state board. And I went, you're kidding. Oh my goodness, it's archaic. Normally they're going to use the word atrium, but I put it up here because if it's going to pop up on your state board, you need to be aware of it. The 2 lower chambers are called ventricles. And one of the state board questions is the heart leaves the blood from which side of the heart? And the answer is the left ventricle, which is why when you look over at the signs of heart attacks, you see obviously pain and pressure in the chest because that's where the heart actually is. But you could have a pain up the left side of your neck because as the blood is leaving the left ventricle, it can put excess pressure there. It can also give you a pain down your left arm, and it can cause you to be nauseous. Nausea is the #1 sign of a heart attack in women, and it's often very confused with indigestion. For instance, we had a friend, he had dinner with his wife, and he goes, I don't feel good, I'm going to lay down on the couch. And when she went back to check on him, he'd already died, he expired. And that was the nausea, which is why if you have an AED machine, you can quickly check to find out if it's actually nausea or if your heart is in distress and you need medical attention. You need to know that. Diaphoresis is sweating, and diaphoresis is always there, and that's that cold, clammy feeling that you sometimes get when there's too much humidity. Sometimes if you get scared, you'll have diaphoresis. Just because you have diaphoresis doesn't mean you're having a heart attack. But if you have one of these 4 symptoms, plus you're diatheretic, then you need to get to a doctor quickly, to a hospital, and or have an AED machine where you can find out exactly what's going on with you. When the heart and the left ventricle, normally your heart beats, that 80 beats a minute, and it's common, but there is sometimes when your heart will go into fibrillation, and that means this left ventricle that pumps that blood out of the heart, instead of pumping, it quivers like this, and that's called fibrillation, and that's why we have a defibrillator, and it's the electrical shock the AED machine poof gives you. It stops the heart and then lets it start back up again in its basic sinus rhythm. Sinus rhythm is the medical term given to a normal heartbeat, or your sinus rhythm. When they're looking at that EKG, EEG, okay, and you're seeing those little lines go up and down, sinus rhythm is what's normal. When you're in the salon, and especially estheticians, now, Cosmo, your license covers skincare. So your license allows you to do anything an esthetician can do. And knowing that, the state board is very emphatic that you learn about the electrical currents, the galvanic current, the high frequency current, and any of the tools that use electricity. The clippers don't count, even though they use electricity. They're not connected basically to a client. But when you apply a direct application to electricity and it's going through my body, then my central nervous system is going to pick up that electrical response, and there's going to be some type of reaction. Now, the state board would also like you to know about the arteries, veins, okay, and capillaries. Arteries carry blood away from the heart, and normally it's oxygenated blood. Okay, so normally it's pure blood. Oxygenated means it's healthy. It's ready to go back to other parts of the body to give nourishment and such to your body. Then you have the venous blood, which brings the blood back to the heart, where it can be pumped into the lungs for reoxygenating, where it comes back into the heart to go out the veins. So you have this circle of blood circulation going through your body. Capillaries, on the other hand, connect the arteries to the veins. And in skincare, it's very important that you understand capillary action. The epidermis, the outer layer of skin, has no blood supply of its own. Arteries and veins go through all your body, to the liver, to the heart, to the lungs, to your muscles. And then there are some places in the body where an artery and a vein don't carry. That's where the capillaries come in. So as you're walking and exercising, the systolic pressure from the muscle moving and your heartbeat takes the venous end. The capillary has 2, and there's a picture of this in your week 2 module. Okay, you'll see that the capillary has what is referred to as an arterial end, which is designated by the color red because that's pure blood. Then you have a venous end, which is represented in the picture by the color blue. And when I have systolic pressure, my muscles are working, I'm running or whatever I'm doing, and I have that pressure from my heart rate, which is going up, it takes the blood from the arterial end of the capillary and it brings it up into the skin. Unfortunately, that doesn't happen with facial skin. Unless I go like that, or I sit around and go, I make all these weird faces, I don't get that muscular action in my face. So when we're doing massage, or we're stimulating what we refer to as blood and lymph flow, and we're bringing nutrition up into the skin so that it can stay healthy, then this is what happens. I brought all this nourishment, food, oxygen, etc., up into the skin. But if I do not expel the carbon dioxide and cellular waste via my lymph drainage massage, I have only one place for this toxin to go, and it comes out through my skin, and we call it breakout. So now that you're in skincare or whatever, aesthetics and or Cosmo, because remember you can do that. Now that I'm doing facials, can I give you a facial? And they go, no, that's okay. Every time I get a facial, I break out. This is the number one cause for breakout, is with the stimulation of blood and lymph, bringing all the nutrition up into the skin cells. If we don't expel the carbon dioxide and cellular waste, it can only come out through the skin. And it doesn't happen to everybody. Some people can reabsorb it beautifully. Others don't, and it actually causes breakout. So it's imperative that I understand my capillary action. In your handouts, you'll find that there's 3 types of capillaries. The state board isn't going to go into that, but as an esthetician, or if you're going to enjoy skincare, then you need to understand the type of capillary that is a function. Okay, I'll get it out yet. Providing nourishment and function to your epidermis. Super important. So the takeaway for this class would be the 4 chambers of the heart, and the left ventricle is the one that takes blood to the body. That's a state board exam question. The signs of a heart attack, so that if I'm around anybody who's having any signs of distress, I know when to recommend they see a doctor, especially in my salon. My electrical appliances can irritate the skin. So on your client record card, you need to make sure you have a list of their medications. And if you see anything there that's a heart, high blood pressure, sometimes high blood pressure almost always includes a diuretic to take the extra fluid out of the skin. So if there's any type of medication that is for the heart, they are what we call contraindicated to electricity. And obviously a pacemaker is a definite contraindication, which we will probably talk about in the next video that does the central nervous system, because that's the actual electrical component that keeps everything working like it's supposed to. And it's super important that you understand the basics of the heart and how it functions, the basics of the central nervous system and how it functions, how they work together to keep you healthy, and the fact that we're using some tools that can have an effect on those 2 systems. So my takeaway, once again, ventricle to the heart, my signs of a heart attack, diaphoresis is always there, my capillary action, and my normal blood pressure. The only, they do ask questions on the state board for some reason, especially in aesthetics. They like the nervous system and the heart, but obviously this is the reason, because these are the 2 systems that you don't want to malfunction. You have to keep your client healthy and safe, and that's number 1. Remember, state board, client protection, health, and safety.